Hi, today we're going to be talking about the Incident Command System and how that relates to both public health as well as the Medical Reserve Corps program. We have three objectives today. The first being an overarching view of all the components of the Incident Command System as shown on FEMA's training website, starting from a top-down look. So big picture all the way down to the daily tasks that you as a volunteer might do in an incident. Our second objective is to talk about how it all fits together. Each training module talks about a specific component of incident command, but they are all interlocking and scalable. Third is to talk about why we use ICS, when we would use it, and where we would use it. We know the who. The who is all of us, whether you are the incident commander on a scene all the way down to the newest worker. And we know how, or we will know how after this presentation is done. So starting from the top down, we want to discuss the National Response Framework. It is, as the title implies, it is a framework on how incident command is carried out across our nation. This is a federal document that guides how multiple agencies, whether they are local, state, tribal, for-profit, nonprofit, how all of us interrelate in emergencies. Whatever the disaster, everybody at any level in any community is working using the same common public health responsibilities or general responsibilities to preserve and to restore the safety of their community. So whether you are responding to an incident in Washington State or down in Florida, the National Response Framework is going to make sure that all of those responders are working under the same structure. The National Response Framework also talks about relationships. Relationships with response partners are created before the disaster strikes, which leads them to become as engaged in the crisis as you are. Engaging partners is an essential component of preparedness. The bottom-up framework means that every incident begins with a local response, then expands up through various levels as needed. Response to a local public health emergency will begin with the municipality affected. You may seek help from local engaged partners with capabilities required by the incident that you can't provide yourself. When the problem exceeds your capability to mitigate or extends beyond the borders of your district, you'll seek help from external partners who do what you do. As the incident escalates, the outreach goes higher to the state and possibly the federal government. This bottom-up approach is known as tiered response, which means that incidents are always handled at the lowest jurisdictional level possible. Public health response, like any type of response, is scalable, flexible, and adaptable to the situation at hand. The type of disaster may differ, but what public health is capable of doing does not change. If you have no radiation contamination detection or mitigation capabilities, for example, having a medical surge due to radiation contamination event does not suddenly bestow that capability upon you. But those skills that you have can still be applied to it. If you're trained in providing medical surge or gross decontamination as part of your MRC duties, those principles are the same no matter what the cause of the incident. You use the capabilities best suited to mitigate the problem, and you use an engaged partner to assist you with needs outside of your scope. National Response Framework also talks about being ready to act. Ready to act is all about preparedness. Prevention's always preferable, safer, and cheaper than response. FEMA recently stated that every dollar spent on prevention saves $5 in response and in recovery. So we know all about preparation. Our MRCs focus most of their work on prevention by teaching preparedness and by equipping the public with skills that will help them remain more self-sufficient in emergencies. The resilience of a community directly affects its ability to get up and move on after a disaster. So if we focus on preparedness for most of what we do, then the response work that we have to do is minimal. So going on toward preparedness, when a response is needed, having procedures, equipment, and training already in place so you're ready to act is key. Prescripted response actions, such as who to call, what responsibilities you're in charge of, what resources are available, what communication paths to take, are designated by various response plans. Some of these are plans that your local municipality may make. Some of these are state level response plans. Others may be things that are internal to the Medical Reserve Corps program. The National Response Framework is also the document that outlines what we call emergency support functions. There are 15 emergency support functions that help describe preparedness needs and categorize mitigation efforts by organization type. Many emergency operations centers organize their operational work around these functions. Alternate models of emergency operations group response agencies differently, but all with the goal of fulfilling these essential functions. So for the case of public health in the Medical Reserve Corps program, most of our duties fall under ESF 8, which is public health and medical services. We have a number of support functions that we also fulfill. You may see some of the duties that you work with in an emergency under ESF 2, which is communications, ESF 6, which is mass care, emergency assistance, housing and human services, and under ESF 8, agriculture and natural resources, which deals with the environmental impacts of a disaster. All of these support functions tie very closely into the public health work that we do, both as staff and as volunteers working in a public health response. The National Response Framework is about getting ready, then putting preparedness to work with your engaged partners. The National Incident Management System, or NIMS, which is what we're going to be talking about next, creates a common structure for everyone to work under. So the National Incident Management System, or NIMS, is the next scale down in the incident command framework. It offers a collaborative approach for working at events that require multiple jurisdictions, such as public agencies, private companies, and non-governmental organizations. NIMS is a consistent national template for anyone to use so that when different entities have to work together, everyone knows what's expected. So again, we see the theme of preparedness. Preparedness is the state of being ready. And 3 or 4 examples that we can think of in terms of preparedness in relation to NIMS could be things like vaccinations, MRC recruitment of skilled personnel, personal preparedness outreach in our community, and planning, particularly the type of planning that is across agencies, such as identification of priority populations, mapping of disaster-prone areas, evacuation and sheltering plans that might involve our healthcare entities or our schools or other priority populations within our community that need to be protected. Communications is huge. In any incident, communications is our ability to share information with any and all others working in an incident. Interoperability is a catchphrase that we use, which means a multimodal form of communication. How our health and public health resources communicate with each other is really important, and our normal modes of communication in an emergency may go down. So we talk about how do we communicate, whether it's word of mouth or whether it's traditional mainstream media like your television or your radio. Within our work, do we have access to things like cell phones, sat phones, ham radios, text alerts? How do we get the word out both internally amongst our staff and volunteers, as well as out to our community and to our partners? It's important that we have data storage and retrieval capabilities, that we can have a way of processing incoming and outgoing information, such as what does it mean and how does it affect us, and then sharing that information and knowing what and how to share that information. Resource management is another component of the National Incident Management System. So, what things do you have to execute your capabilities? That's talking about material resources, so whether that's water, whether that's vaccines, whether that's water test kits, all the way up to the human resources, yourselves. In many cases, human resources are the most important asset because having trained, skilled people available to help enact plans is key. If you do not have folks, then you cannot provide a response. And lastly is that information piece, making sure that communication gives us information that is going to be good for ourselves to act on and for the public. Command and management, or command and control, is the next component of National Incident Management System, and this feeds directly into the ICS, the Incident Command System. Organizing and overseeing communications, information management, and resource deployments falls to a common system of command and management. And then again, that takes us into IS 100 and 200, which are the two components of incident command. So we're going to combine these two modules here because we really want to talk about this in a seamless environment. IS 100 is an introduction and overview of the incident command system, and IS 200 talks about ICS is used to manage incidents. So ICS, or Incident Command System, is a standardized approach to incident management. It establishes common structures and management by objectives for planning and overseeing resources. It allows for seamless integration of resources from outside of the agency and with partners who are also operating under the same ICS structure. It establishes a common process, such as who is in charge. Where do we get item X? Who pays for item Y? Who do we call to get item Z? Without knowing those things, you cannot directly manage an incident. And with the ICS system, you are able to actually be able to understand what the reporting structure is. Whether you're going to someone else's incident or you're receiving assistance, diverse entities with drastically different roles and capabilities can still integrate seamlessly because everyone is already on the same page using the same operational structure. So, who are some partners that you think the MRC commonly works with? Most of our partners fall within this range on the slide. So community partners, local government, regional, state, and federal entities, as well as those national and international agencies and non-governmental organizations. So for example, we're always working with our local municipalities and our state government here in Vermont. Very regularly, we work with our hospital and our healthcare partners, such as our long-term care facilities, our dialysis centers, our primary care offices. We tend to work very commonly with the American Red Cross, particularly in sheltering. We work alongside disaster animal response teams at our shelters to make sure that companion animals of the people that we are serving are taken care of. We work alongside behavioral health teams to make sure that both the mental and the physical health of the people that we serve are being cared for. So all of these components and more fall under ICS and have a role. So again, this talks a little bit more about that scalability from National Response Framework all the way down to Incident Command. As a review, NIMS offers a common structure. So like all entities can prepare to operate in similar fashions no matter where they are, ICS is the tool to use when that disaster happens and to operationalize the work that we've planned for. It's how the plans and resources turn into effective actions. It's all about breaking down an incident into manageable pieces and being responsible both for the people you oversee and the environment you're working in. That fun catchphrase, it's not my circus and not my monkeys. Well, this is our circus and this is our monkeys. And in ICS, we take responsibility for what is ours. So whether you're the person in charge or a member of the team, it's your responsibility to ensure that you stay on task and that you do it safely and efficiently, so that you can achieve your objectives for the day. In this day and age, we're seeing more frequent disasters and larger, more complex incidents. ICS is useful for any type of incident that you face, whether it's natural disasters, whether it's something that's human caused, or whether it's a technological hazard. Very often we see a combination of these factors. For example, during COVID, We saw cybersecurity threats to some of our hospitals that also impacted patient care above and beyond what the pandemic did. And it's important that ICS can be scalable and flexible to manage concurrent incidents or incidents that may be much harder than we originally thought going into things. The wonderful thing about ICS is that you can always build on the structure that's provided to you. So next we're going to be talking about ICS structure. ICS puts the right people in the right places to make decisions to change the outcome of a problem. It establishes roles and responsibilities to ensure the right people are using the right resources to make the right decisions to solve whatever problem is at hand, whether large or small. It's also modular. You can assign individuals to separate functions that all crosstalk with one another, or in a smaller incident, you can have one individual that wears multiple hats and takes on many roles. Ideally, whether you scale up or scale down is going to be dependent on who is available to you, what their skills are, as well as the incident that you're facing. So this is a basic overview of an ICS org chart. These terms are common, again, across the nation. So somebody designated as an incident commander is always going to be incident commander. Somebody designated as a safety officer is always going to be the safety officer. Those roles are predefined and the tasks assigned to those folks do not change. ICS works in what we call a chain of command. So this means there's a defined route for giving and receiving orders and information up and down the ICS hierarchy. So for example, the operations section takes orders from and reports to incident command and only to incident command. The person in the operations role is not talking to all the other parties on this chart and trying to figure things out other than from day-to-day collaboration. The incident commander is the operations section chief's sole point of contact to report. Again, similar for these other sections. The planning section chief is only talking to the incident commander, and so on and so forth. There will always be communication between positions at the same level in the command structure, but none of them have any control over one another. These are all colleagues that are working alongside one another to make sure that the objectives of the incident are met. Now, we also want to talk about unity of command. Unity of command means you're responsible only for the people below you and you only report to the next level you're working for. So, for example, these 4 supervisors in the org chart all report to the operations section chief, who reports to the IC. That's all they really need to know about the structure. So the EPI group does not need to know what the vaccine group is doing, other than things that directly impact the vaccine group's ability to work. These are all collaborators, but none of them are supervisory over each other. At the next level, these 3 functions report to the epidemiology group supervisor, who is only responsible for them, and reports to operations, who reports to the IC. As you can see, these structures are scalable. The larger the incident, the more tiers in the chart, but again, the unity of command ensures that you are only speaking up and down from a reporting point of view, and you're only speaking across the chart from a collaborative point of view. So next I want to focus a little bit on the ICS positions. Everything begins and ends with the incident commander. As an incident commander, you have overall command of the entire incident and are responsible for everyone working below you. In a good ICS structure, you maintain a span of control so that you are only supervising between 3 and 7 people, with 5 being ideal. So in this example, the incident commander has 3 command staff, public information, safety, and liaison, and they oversee 4 different sections of the general staff: operations, planning, logistics, and finance admin, for a total of 7. Anything further will fall under one of the other sections to supervise so that the IC is not overwhelmed. So the 3 command staff positions are pretty self-explanatory. The public information officer is the incident commander's eyes and ears on what's going on in the media, and the only person authorized to release information to the media or public. They're crafting messages for audiences, monitoring media feedback, misinformation, and what's going on in the communities. The safety officer is responsible for the safety of everyone on the incident, no matter where they're working. So as you might imagine, that person will probably have folks working in each operational section to make sure that on-site safety is being taken care of, and will amass those combined reports to change the work that's being done and create a more safer environment. The liaison officer coordinates with other response partners. This person may be put out at an incident command post, may be embedded in an emergency operations center for a neighboring town. If the incident spans cross-town borders, that person could be anywhere. But that liaison's job is to gather information and to share information. So next I briefly want to talk about the general staff positions: operations, planning, logistics, and finance admin. Your operations section is the section that gets things done. Once a plan of action is developed with goals and strategies identified, the plan goes to operations, who identify what tactics will be used to accomplish the strategies and achieve the goals. So they're the do-it folks. Your planning section are there to collect information, evaluate needs, make forecasts, and draft strategies that will be used by operations to get things done. So the planning section talks about what did we do, and what do we do next. Your logistics section is there to get stuff, whether that is supplies, whether it's equipment, or whether that's manpower. They are the folks who are making sure that those on the ground in the operations section have what they need. And the finance and admin section is what makes everything else run smoothly. Not only are they making sure that you get paid and they get paid and everybody gets paid, they're responsible for all incident costs, financial considerations. They collect procurement, receipts, timesheets, compensation claims, and any other documentation needed to make sure that the incident is a well-oiled machine. So next, I want to talk about that span of control a little bit more. Remember we said that ideal span of control is 3 to 7 folks, with about 5 being ideal. If you exceed the number, it's usually better to continue branching out in your chart with subspecialties, or break your chart down by geographical locations instead of function. You never want to have too many people to control and divide your ability to manage more than that. In an organization this size, leadership positions at this level can be titled in any way that fits your organization. For example, your fire department would likely label these boxes: suppression, ventilation, search, salvage. At a mass casualty incident, your EMS might use terms such as medical, triage, treatment, transport. For your public works or Department of Transportation, they may divide the duties into roadways, bridges, culverts, and signage. So, for example, span of control for a public health incident. You have an epidemiology group supervisor, Susan. She oversees 3 different data collection teams that are pulling up epidemiological data. Each team has their own team lead. So again, John, Susan, and Patty are our team leads for these systems, and they have folks underneath them. So EPI's span of control is over 3 teams. This supervisor's span of control only includes the team leaders. So she has 3 folks under her, and each of these team leads has 2 additional folks under them. That way, Group Supervisor Susan is not overseeing 9 people, which exceeds her span of control. There are other terms that the Incident Command System trainings at the federal level discuss. We're not going to go into them today. However, please keep in mind that as you change the scope of your incident as you have more complex operations on the ground, as you have more geographical areas to cover, as you operationalize or manage different subsections. These terms will come into play. And when you take the next level of ICS, you'll discover more how these are used. Leadership basically needs to know that this basic structure exists. And after that, knowing how to organize functions into groups or teams will define itself based on size and the complexity. You, as an MRC member within the incident command system, basically need to remember the two concepts of chain of command, which is where do I fit in, as well as the unity of command, who do I report to and who reports to me. Incident command system does not need to be unusual or complex. Again, this is a structure that anyone, anywhere can use. I hope this overview has been helpful for you, and we look forward to working with you in upcoming incidents as a member of the MRC.